Smell is perceived by neurons that extend through the cribriform plate into a small area in the superior nasal cavity known as olfactory mucosa. Odorants reach the olfactory mucosa in two ways: anteriorly through the nares or posteriorly through the nasopharynx. This posterior pathway allows for the perception of flavor. Because of this, patients with olfactory deficits may present with taste dysfunction. Complete loss of olfaction is known as anosmia, while diminished sense of smell is known as hyposmia. When assessing olfactory loss, it is important to consider two major categories: conductive and sensorineural. Obstructions of the nasal airway cause conductive losses by inhibiting odorant molecules from contacting the olfactory epithelium. A common cause of conductive loss is sinonasal polyposis. A less common cause is sinonasal malignancy. Conductive losses should be evaluated with nasal endoscopy or CT MRI. If no conductive lesion is identified, consider a sensorineural etiology. Upper respiratory tract infection may begin with a conductive olfactory loss. This can progress to a post-viral olfactory dysfunction from injury to the olfactory mucosa. Head trauma may also produce sensorineural loss due to shearing of the olfactory neurons. A slowly progressive loss of sense of smell is common with aging. However, anosmia or hyposmia can also precede the onset of many neurodegenerative disorders, such as Alzheimer's and Parkinson's. Patients presenting with taste dysfunction secondary to an olfactory etiology often cannot detect specific flavors, but can still differentiate between the 5 basic tastes. Those with primary taste dysfunction, though, will often lose the ability to differentiate between the 5 basic tastes. Primary taste disturbances can be due to injury to the tongue itself or the nerves that supply taste. Think cranial nerves 7, 9, and 10. Keep in mind that many medications and systemic illnesses can lead to alterations in the ability to taste or smell. Be sure to include these possibilities in your differential.